And for today's Medical Minute segment, we are talking about how hearing loss affects both ears and the important role that your support system plays in treating hearing loss. Ted Blanford of Summit Hearing Solutions joins me now with more. Ted, always good to see you. First of all, talk about that support system.
Well, we're talking about the third party. In the industry, they call it third party. I call it family support or your friends. Hearing loss doesn't just affect the person with the hearing loss, it affects everyone around them. Your spouse, your children, your grandchildren, especially those that need to have that personal connection that only hearing can give you.
So what can they do to
Well,
support?
The journey from the beginning all the way through, if your spouse or someone special to you is with you more often than not, have them come with you for the testing, have them come with you for the adjustments, because I get as much information from the family as I do from the patients to make the patient's communication environment as close to normal and natural as possible. And believe me, when your spouse is happy about your hearing, everyone's happy about your hearing.
And you can learn so much more about what is actually going on. And talk about hearing loss in both ears.
Now, hearing loss in both ears is also the effectiveness of the hearing loss in your brain. If we have a loss in both ears and we only take care of half the problem, we're not taking care of the problem at all. We're actually completely off balance because our brain, different portions of our brain also use different portions of our communication. Sound processing as opposed to speech processing. And if you don't take care of the entire problem, you're really shorting yourself out of the clarity that you need and could cause more problems down the road.
And that can make a dramatic improvement.
A huge improvement, especially when you're talking about clarity in conversation in background noise. It's impossible to hear normally with only one ear. And when you only correct one ear, that's essentially what you're doing.
And you hear that all the time. Well, that's so-and-so's good ear. Talk on that side.
Exactly. There should not be a good ear or a bad ear. It should be, unless it's completely gone, and we actually have solutions for that as well. But we should be taking care of the communication issue, not one ear or the other. It should be the entire package, the entire solution. And at Summit Hearing Solutions, we counsel through the entire journey with that in mind of making sure that we take care of everything the way it's supposed to.
And you've seen dramatic results.
I have. Every day we have.
Absolutely. All right, Ted, thanks so much for coming in. And you can find out more about Summit Hearing Solutions by just heading to the website or calling the number right there on your screen. Right now, Alyssa, we'll send it back to you.